Homelessness and Addiction, Environmental and Cultural Factors by Ashley, Misty, Rachel, Rhiannon. Health concerns. According to the National Coalition for Homelessness on 2018, one of the common causes of homelessness is addictive disorder, which can disrupt relationships and cause on to lose their job. Basil, Geeds, and Kushel 2014 explained the homeless population are at great risk for communicable diseases such as tuberculosis, sexually transmitted diseases, hepatitis B and C, immunodeficiency virus, and scabies and/or lice. Basil and Geeds and Kushel 2014 further explained the high risk of non-communicable diseases such as chronic obstructive pulmonary disease, cardiovascular disease, addictions of substance and/or alcohol abuse, infections and wounds, urinary tract infections, mental health illness, diabetes, tobacco use, and hypertension. According to the National Healthcare for Homelessness Council 2018, the homeless population has a 10% higher suicide rate, and half of the homeless individuals have had thoughts of suicide or have attempted suicide, according to the National Coalition of Homeless, 2018. The homeless population is at much greater risk of being harmed by others. Cultural environmental media. The Council of Homeless Persons 2014 explained that most people view the homeless the way the media portray them. With this study that was conducted, the homeless were perceived as 40 plus years old with have a mental illness, sleep rough, does not seek or accept help, and are addicted to either drugs and or alcohol. The study also showed that multiple people reported they believed that the homeless individuals are responsible for his or her situations, are criminals. There is a decreased feeling of empathy from society, and people are frightened of homeless population. With this vision, the homeless is likely anyone will engage with the community to volunteer or help make the change for the population. This portrayal of the homeless population is inaccurate. There are many situations that can cause someone to become homeless. Yes, having an inaccurate vision of this population places them at much higher risk of danger and misunderstanding, according to the National Coalition for the Homelessness 2018. There is a doubled amount of bias-motivated fatalities and violence toward this population, naming it as a no-safe street. Cultural, environmental, family support. The homeless population is at risk for poor outcomes, but when there is not family support for the children that are victims of homelessness, they suffer as well and from a young age. Comparative studies with house samples have shown that homeless children are more likely to be exposed to inadequate nutrition, violence, and parental mental health difficulties while receiving lower levels of social support. Bradley, McGowan, and Michelson, 2018. Family support is imperative for the homeless family. For homeless, families can help to support not only the homeless family member, but their children as well to help prevent these poor outcomes for children. Bradley, McGowan, Michelson, 2018 also described homeless children having an increased rate of behavioral problems, including sleep disturbance, aggression, and hyperactivity. Family members can reach out when possible to help those that are homeless to help prevent these effects children are experiencing due to homelessness. Children and young adults need support through rough times, and without it, poor outcomes are destined to happen. Peers can have an influential impact on someone with addiction or homelessness. It was also found that peers describe benefiting from helping, such as undergoing transformative identity developments that helped them to escape homelessness. Barker, McGuire, and Bishop Stopa, 2018. This study concluded that getting to know someone while they are going through a difficult time can help them to cope with the situation and deal with it in a more positive way. Having a positive influence in one's life can help a person cope better and make better choices. Having a peer for support can have a significant impact on homeless person's quality of life by reducing alcohol, drug use, improving mental, physical health, and increasing social support. Barker, McGuire, Bishop, and Stopa, 2018. On the adverse side of having someone supportive while going through a hard time, having someone that is not supportive can have the opposite effect on one's life and have a negative influence. Cultural environment. Cyclical nature. Children born, raised, or entering homelessness at a young age have a higher instance of continuing the cycle of both poverty and homelessness. Reduction in literacy and vocabulary affects education starting at a young age. Motor development is also delayed. Chronic stress and anxiety are developed at a young age and follows on a secondary education in high school. Many drop out and do not see a high school graduation. This perpetuates the cycle due to lack of education, limiting stable income opportunities. Aid offers this population often requires an address for documentation and allocation of resources. Since many do not have some form of permanent address, this limits access to aid for many, again continuing the cycle. One of the biggest ways to break the cycle of homelessness is education. Helping those affected participate in and or continue their education is imperative. Homeless Cycle 2020. Cultural environment, legal political system. The justice system is all too familiar with members of the homeless population. Unfortunately, it is often crimes committed out of the need of survival, for instance, trespassing. More often than not, members of this population are seeking shelter. The 2019 Injustice Fact Sheet reports the death of a homeless veteran in 2014. Following incarceration for trespassing during the winter months, the man died of dehydration in prison cell. Injustice Fact Sheet 2019. Unfortunately, this is an all too common occurrence. The cycle continues as individuals cannot afford bail or court fees, leading more time served in the justice system. This prolonged and often repeated jail time leads to loss of voting rights and government assistance and benefit. Justice Fact Sheet 2019. Cultural environment, potential barriers. There are many environmental hazards and barriers that the homeless population face according to Medline Plus 2018. Some of these factors include unsanitary living conditions, garbage, air population, and unclean clothing, increased risk for crime and violence, severe weather conditions, rain and snow, fires, heat waves, extreme cold, and natural disasters such as droughts, earthquakes, floods, snowstorms, tornadoes, and hurricanes. Baxter, Tweed, Katikriddy, and Thompson 2019 lists other factors such as lack of resources, washing facilities, transportation, and medical care, rough sleeping conditions, social isolation, and noise. Cultural environment, international scope. Cultural attitude toward the homeless population varies from country to country. It is interesting to note that the countries that are primarily English-speaking seem to view homelessness with a high level of personal responsibility behind it. This can include responsibility for the cause as well as the ability to overcome it. Government assistance varies as well based on the ability of the government in question. Again, English-speaking countries have a greater ability to help and aid this population. It varies on whether or not countries as a whole have a negative view on homelessness. Culturally, countries that are more developed often have a negative view. This is likely due to the vision of possibility that developed countries operate under. Shin 2007. Health disparities, socioeconomic status. It is noted among the homeless population that there are individuals fit for work and those that are not. Even minimum wage positions would require one to be fit for working 5 to 6 days a week with full-time hours. Many are not capable of this. This lack of socioeconomic status affects access to health care due to lack or even loss of insurance coverage. Many do not participate in preventive health screenings, all while having addictive behaviors that already put them at greater health risk, even if they had the socioeconomic status to receive treatment. Shanzer, Dominguez, Shrout, and Keaton, 2007. Health disparities, race, ethnicity. According to Jones, 2016, Black and Hispanic families more disparities due to race. These families lived in more crowded living situations and would attempt to double up before being homeless. Due to higher rent rates and housing costs, these families would end up on the streets. There was a higher report instance of substance abuse in the Black and Hispanic community, along with felonies and incarcerations leading to homelessness. Interestingly enough, the rate of alcoholism was determined to be higher in white families. The Black and Hispanic homeless families tend to be younger in age and mentioned coming from a place of socioeconomic disadvantage and discrimination. There is a higher rate of white homeless families. These families struggled with alcoholism, substance abuse disorder for a lifetime, and psychiatric problems later down the road. Jones, 2016. Health disparities, religion. Having ties with a religious affiliation may help the homeless population. Contrary, individuals or families without a religious tie have homelessness hit harder. Religion has been shown to help provide a community support, helping families stay together with a roof over their head. It has been shown that by doing this, the homeless rate decreased by 29%. Women who have had stronger tie with religion have had greater effect in decreasing homelessness than men. Religion has also shown correlation with decreased drug use, alcohol use, and crime in the homeless community. Consequently, being tied to one religion may have some discrimination in areas where the particular religion is not favored. Coronet, 2017. Health disparities and gender. Colvin explains that many health threats that women face when being homeless. For instance, having limited access to health care, housing instability, which causes a reduction in acute care services, post-incarcerations, low self-esteem, increased level of victimization for sexual and physical abuse, and limited access to community resources. Montgomery, Shivak, and Culhane, 2017, explained that any individual that is homeless is at risk for poor health associated to unsheltered homelessness and lack of health care, with greater risk of early death. There are more men reported as unsheltered homelessness as compared to transgender and women. Women are at greater risk for mental illnesses. Montgomery, Shimkowick, and Culhane, 2017, explained that the transgender population is at greater risk for systemic discrimination, family rejection, lack of transportation for employment, sexually transmitted diseases, sexual abuse, sex work, and suicide. Health disparities, geographical location. Although race was addressed on a previous slide, geographically shows higher race-specific homeless population. It is shown that homelessness can occur in any location, rural or city. However, cities have a substantial increase in homelessness. The East Coast, for example, has a high rate of African American population, while the Southwest has a high Hispanic homeless population. It is shown that New York City has one of the highest homeless family populations in the country. Many factors can affect losing a home: the housing market and an increased population and decrease in homes available in the area. An area with high substance or alcohol abuse, and specifically in locations that experience natural disasters. Baum and Burns, 2019. Health disparities, biases. Johnston, Jett, Dingle, Parcel, and Walter, 2015, explained that many homeless individuals are unable to access services, accommodations are good, and have limited opportunities, unable to join groups, all because of the lack of housing and resources available. There are some that discriminate due to controlled situations of drug and or alcohol addiction, obesity, or unemployment. Discrimination and biases toward the uncontrollable situations such as gender, race, age, religion, culture, sexual orientation, mental illnesses, or disability. They also describe that the society believes housing is under the individual's control and discriminates against homelessness due to the lack of housing, mental illnesses, and or addictions. Health disparities, international scope. According to a study completed at the Yale University, roughly 2% of the population are homeless. Chaimi, in 2017, homelessness can affect both developed and underdeveloped communities around the world. For example, in the global south, homeless individuals are called pavement dwellers because they make homes using the streets and rigid covers to provide shelter. It is also common for slums around the world to provide shelter for individuals. Gietzman, Culhane, and Fitzpatrick, 2016, inform on these individuals and families may be hard to gather. One reason is because of the broad definition of homelessness. Some lack of a permanent home. Some have living situations that are not adequate but still provide a roof over their head, and some even have an absence of living space at all. Here are references. There's 2 pages. Okay, thank you very much.